Hi, my name is Jetri Narda, and today I'm going to be doing IV fluid and med administration. So the first thing I'm going to do is wash my hands, apply my gloves, and inform the patient that I am going to be giving him fluids and medications as per doctor's orders. I would ask the patient if they're allergic to amoxicillin. Patient stated no. I'm going to check my 6 rights: right medication, right patient, right dose, right time, right route, right documentation. And then I am going to talk about the tubings. So this is the spike. The spike will be the part that goes into the medication bag or fluid bag. It's going to pierce it, and then the fluid or the medication will go into the chamber. This chamber allows us to see how many drops per minute or what the flow rate is. The sliding clamp will help us determine how fast or how slow the flow rate can be. The Y port here is where the secondary bag will connect to as a piggyback, and then this last tubing here is the adapter end, and it will go directly to the line with the patient. So after that, I would prime the primary tubing or primary fluid. And just make sure that my line is closed. The spike needs to be fully in, and then open. We're going to give it a quick squeeze for about halfway full. And we're going to prime the line, meaning all the water or the line needs to be primed so there are no air bubbles. So I'm just going to use my garbage bag here and ensure that the line is thoroughly primed. There you go. Close it back up. And set it aside. Prepare it right here on the hook. I'll put it on the bottom. Alright, which is 30 inches away from the IV line of my patient. Okay. And at this time, we're going to calculate the how many drops per minute it would take. So I actually wrote it down here. So since the doctor ordered 150 ml per minute, and what we have is a 15 drops per ml on the IV administration set, we calculate it and we get 37.5. However, it doesn't do half drops, so we're gonna round up. And at this time, I'm going to use an alcohol prep pad, and I will clean the site. Let it dry for about a minute before connecting the primary line with the IV line that goes straight into the patient. A minute has passed, so I will connect now. And at this time, I will visually count for a minute the 38 drops it's required for the infusion of the primary fluid. And I'm just going to put that on pause while I work on the piggyback of amoxicillin. Doctor ordered amoxicillin 250 milligrams in a 100 ml bag of fluid over 15 minutes. So for that, I'm going to prime this as well. Make sure it's closed. Open this up. Open this up. And pierce it through. Pause that up. And then I will begin to prime. Fast. Okay. And then I'll take another prep pad and I'm going to connect it to the Y port. And then let it dry for a minute. Once it's dry, I would connect it. And then connect as so. And then connect it a little higher than this one. And then the same thing, calculate the drops. So for the amoxicillin, I would, it was ordered at 100 mLs over 15 minutes. And what we have on hand for the drop factor is 15 drops per ml. And then we do the calculations and then we get 100 drops per minute. After that, I'll physically count the 100 drops per minute. And then I would just clean up my supplies, inform the patient. I'll be back after the medications are done flowing and infusing. Take off my gloves, wash my hands, and thank the patient, and I'll be back once the infusion is done.